Hey everybody, it's the Movement Doctor, and today we're going to be talking more about shin splints. So some of the misconceptions that we find about treating shin splints is that it's, something where it's just on the bone part. So obviously shin splints, when you feel it, when you have symptoms, it's on the interior part of the tibia here. But what we're finding is that don't focus so much on here, but also think about all the structures that are connected to the tibia here. So you have a little bit more of your tibialis anterior that's connected this way, and also your calf and your soleus is pulling it in the back here. So what we really want to focus on is loosening up all of those structures to help release some of the stress that's being pulled. And when you get the shin splints feeling, is that because all these structures are getting pulled on the tibia, you want it to relax a little bit more in the back. You also got to start thinking to yourself, why am I having shin splints? What is the reason behind it? Obviously, you can treat it by loosening all of this up, but you got to look at the reason why. And it's pretty common in people that are runners or someone that's always moving their limb for whatever reason it may be, any kind of sport or activity. So what we want to do is understand a little bit more of, okay, is it coming higher up in the hip? Is it lack of ankle mobility here? And so answering the question why will help you relieve some of the pain that you're having long-term in the shin splints area. You always want to start thinking a little bit in terms of, again, going back to our joint by joint approach, is it lack of mobility in the ankle? Or is it maybe lack of mobility in the hip, or even lack of strength and ability to contract up here? And now if it's not able to control in the hip, like we talked about, some of the knee pain can be coming from the hip, then this is where it's going to be, compensating a little bit more in the calf and some of the structures that are pulling on the tibia. So really understanding a little bit better of where are these symptoms coming from, why they're coming here. Because again, anyone can treat this. You can loosen this up. You can do, different modalities to kind of help this out. But again, you're not treating the source of it. You're just kind of you're just treating the site, putting a bandage on it. But if you go back to running, it's going to keep coming back. So looking at where this problem is truly coming from. Again, looking up higher at the hip. Do you have enough hip strength? Do you have enough ankle mobility? And that's where you may need to go to a physical therapist to kind of really understand exactly where the problem might be coming from. Please don't forget to like, drop a little comment, and subscribe to our channel for more great content.